Morning, everyone. Welcome. My name is Lauren Carr, and I'm the Opioid Settlement Advisor for CAICO. Thank you all for taking the time to join us today. We appreciate the work that each and every one of you are doing to address your communities and the opioid epidemic, and we are grateful for you to be here, a part of this conversation. We know that it's a very, very busy time for all of our members, and so before we begin, just a few housekeeping items. This session will be recorded and shared with everyone who registered after the training, and it's also hosted on our CAICO Resource Library website. So you can check out any of our webinars that we have done. They are all archived on there. I can show you where that is located at the end. And please use the chat for questions and comments throughout the session, but we will have time at the end for questions and answers, and this webinar does qualify for 1 hour of training credit. Next slide. All right, as many of you know, Kentucky counties are continuing to lead the way in thoughtful strategic use of opioid settlement funds, but we understand that this is not our members' subject matter expertise. They are not used to opioid settlements or anything like that. So to support this work, CAICO has launched the Opioid Solutions Network, and it's a 9-part learning series. And what we are going to do is trying to digest each of the core strategies outlined in Exhibit E. And each month we are going to show you examples of how these strategies are already being implemented in communities and what you can do on your own. Tips for impact, sustainability, and compliance. And our hope is that this series helps counties better understand the allowable uses, but also connect with leaders in your community, because we know that you all can't do this work alone. Next slide, please. All right. So on your screen, you will see the allowable uses of opioid settlement funds. These are in the National Settlement Agreement. I always sometimes get asked, I don't want to say all the time, but is this federal dollars? Is these grant dollars? At the end of the day, I just want to remind everybody that this is a settlement agreement. So the uses of these funds have to tie back to the National Settlement Agreement. So today's session, we're going to be focusing on warm handoff programs and recovery resources. What we'll walk through is what warm handoff programs are, how these programs can support recovery and reduce overdose risk, the role that counties and detention centers can play in connecting individuals to care, and examples of successful implementation in Kentucky communities. Also, finding considerations of how these opioid settlement funds can support these initiatives and make that direct contact. Warm handoffs are more than just a referral. They are about creating a direct connection to treatment, recovery support, housing, peer services, and critical services at the time when people are most vulnerable. Next slide, please. On the screen, I just copied and pasted the language from Exhibit E, so you can see how these dollars are supposed to support individuals in recovery. And so these can be anything from wraparound services that you're going to hear later from our great speakers today, but also housing, transportation, education, job placement, job training, or childcare. I try to tell people that we don't have to reinvent the wheel. Think of things that are already happening in your community and how can you expand it. So for example, I was talking with one community, and one of the biggest barriers was transportation, getting people to and from things. And so they were able to support transportation by gas cards or mileage or Ubers. It all depends because it's all a local issue, but the support that with these abatement funds. So also thinking about what you already have in your community and how you can add to it. Also, again, you don't have to do this work alone. So connect with recovery community centers, groups that are working in your community, whether they are like examples of like Young People in Recovery, which is YPR, or recovery community centers, RCOs. There's a bunch of acronyms, but also engage nonprofits and faith-based communities and community coalitions to support this work. And also support stigma reduction. Again, one of the things that I always share is sometimes the hardest battle is getting back into society, and that stigma is there. And so there's barriers that we take for granted that most people see. And I was at one county's program, and the individual, and I know you're going to hear stories about this, but the individual that they helped, he needed contacts, and able for him to get contacts, he was able to excel and do things. And so things that sometimes we take for granted, these funds can support. So to really help people. Next slide, please. Again, some more language of how these funds can help those incarcerated population. So that is covering everything from treatment. You're gonna hear the initials MAT and MOUD. They are interchangeable, but it is treatment to help individuals with opioid use disorder. Increase funding to provide that and support evidence-based withdrawal methods. And so this is all language from Exhibit E, which is the National Settlement Agreement. And next slide. So just we are already seeing counties across Kentucky put these strategies into action. So Montgomery County and Graves County are both great examples of how they have invested local opioid settlement dollars into warm handoff programs within their local jail systems. All the way in the west, you see Graves County. They partnered with their local ASAP coalition to provide backpacks, recovery backpacks for every individual leaving the jail. And this is one of the communities that doesn't really don't have a jail. We have an RC center, but they are providing those reentry services, Narcan, connections to care, referrals, and these backpacks are just made ahead of time, and then when individuals are transitioning out, they get a backpack upon release. And then what we're going to hear more about, which I'm so excited, but Montgomery County supported the First Day Forward program through opioid settlement funds to expand reentry services for individuals transitioning out of incarceration. And so at this time, I would like to introduce our speakers, Carla Terry and Brittany Harrington, who will share more about the work that they are doing with their partners in their local jail. Carla Terry is the Director of Graduate Medical Education Grants Contracts at St. Clair Healthcare, where she has worked since 1990. She has been involved with the Northeast Kentucky Substance Use Response Coalition since 2018 and currently serves as the project director for the HRSA RCORP MAT, lots of letters, expansion grant, supporting expanded education to medicated assisted treatment in rural clinics. Brittany Harrington is the Peer Program Coordinator of Pathways and the Project Coordinator of the First Day Forward program. With 9 years experience in behavioral health, Brittany coordinates peer support services across 10 counties, helps train new peer supports, and as somebody in long-term recovery, she is passionate about supporting individuals and navigating them into reentry. Next slide, and now I turn it over to Carla and Brittany. Thank you all.
Hello, I'm Carla Terry, and as she said, I'm with UK St. Clair in Moorhead, Kentucky. I also work with one of the departments, AHEC. AHEC stands for the Area Health Education Center. They were created by Congress in 1970 just to help communities pull together more about health careers promotion, clinical rotations, continuing education, and community health. Like all of the students, residents, any learning individual that goes to a local hospital or clinic in our service area, AHEC takes care of the rotation for them. And one of the big items that we've been focused on in the last couple years is community health. And we saw a lot of that come about during the opioid epidemic when we decided to put a team together to look at what the needs were of the communities. Next slide, please. So there are 8 AHECs across Kentucky. Our AHEC is the Burgundy. I'm using my pointer. Of course, you can't see it. Our AHEC is the Burgundy maroon colored counties in the Northeast area. Next slide, please. That's our counties that we serve, our total population around 322,000. Next slide. So these are our coalition members that make up, it's a mouthful, the Northeast Kentucky Substance Use Response Coalition. And the reason we started this coalition, we applied for a planning grant in 2018 because we had been seeing a lot of the opioid usage in our area. We'd had a lot of feedback from providers. Even new doctors coming in didn't want to get their DEA because they didn't want to have to tell patients that they couldn't prescribe them an opioid. We also had a physician join the hospital that was doing some addiction medicine, and she worked closely with a lot of the providers, and that's when we started saying, we've got to do something to educate the community, the parents, and to help the people that are in usage. So our partners are Clark County Health Department, Pathways, which Brittany works for, the AHEC, Comprehend, their community health center in Mason County, UK St. Clair, Morehead State University here in Morehead, Tri-State Primary Care. He has a primary care practice in Carter County, the Gateway District Health Department, Recovery Round County, it's a local RCO, and we also have added the Carter County School System to this. Next slide, please. So how we first began, if you see all of the counties highlighted in burgundy, that's when we got their first planning grant. And we decided to go out into each county, talk to community leaders, individuals, and just say, what are you seeing in your county? And what do you feel like an organization or many different organizations combined could do to help you all with the opioid epidemic? And then the counties highlighted in blue, that was the second planning grant where we added some new partners. And we went out to those counties. One of our coalition members actually said, we have assessed these communities to death. They don't want anyone else coming in to do an assessment. They want someone that's going to come in and do something. And she said, if you really, really want to know where to start, go into the jails, talk to the individuals in the jails because they're the ones that are suffering the most from this. So our team members, we actually went into the jails, interviewed up to 20 clients per jail and asked them, what do you need to help you be successful when you get out? How can you live a life of recovery? Next slide, please. And then Brittany was introduced to our coalition and she was God sent. So Brittany, we all sat down at this big whiteboard and we're like, what do we need to do to help people? So that's when the implementation grants started coming out. So Brittany helped us identify anyone coming out of jail. They need a birth certificate, they need an ID, they need safe housing, they need resources from the get-go to help them be able to lead a life in recovery. So the first grant that we applied for was the Implementation 2 grant, and we started working in Clark, Mason, and Powell jails. Then we applied for the Implementation 4 grant, which we did in Carter County. The next one, we were able to go into Montgomery and Rowan County jails. At the time that we applied, Lewis County still had a jail, but by the time we got the grant, their jail had closed. And then Greenup and Boyd County jails, we were trying to cover all the jails in the AHEC service area. So Greenup and Boyd County are not eligible for these HRSA grants that are the ARCOR implementation grants because according to them, they're not rural counties, not rural areas. So we talked to the sisters, the Palatine Foundation of Huntington, and the sisters gave us some funding to do the First Day Forward program in Greenup and Boyd. As you'll see on the screen, most of the grants have ended, but we've been so blessed. For the Green Grant in Mason County, Comprehend, one of our partners who provides the peer support for the jails, they've been able to get a couple of grants to keep us going, to be able to do the jail reentry work. So we're funded through their grant currently through June. And then we also partnered with Primary Plus and got a justice involved grant where we can do that in Mason County as well. For Carter County, Healing Appalachia gave Pathways some funding to continue the First Day Forward program there through the end of 2026. Um, we also have, under the Primary Plus grant, we also are able to cover Brown, Mason, and Greenup. And then Palatine gave us some additional funding, and we're funded through June of 2026 this year. Next slide, please. Well, this is where we get into the meat and the nuts and bolts of the program, First Day Forward. And Brittany Harrington is going to take over from here and tell you more about First Day Forward.
Thanks, Carla. And I really appreciated what Lauren said right off the bat when she said, we don't need to reinvent the wheel. Carla talked about a coalition, and my boss is actually on here, Marianne Moda. She's the addiction director here at Pathways. She invited me to this coalition. It was all important people like her and doctors, and there was a doctor who was also a lawyer. Like there was just, I was out of my element. But when they started talking about serving the incarcerated population, it was really cool because the group listened to me. And I remember one particular time I became incarcerated, and the biggest impact during all my rounds of incarceration was the time I met someone else in recovery, and they'd let her come into the cell. She shared her recovery story, and she gave me a little book, a 12-step book. And I did everything she told me to do when I got out, and I stayed sober for many, many months. And I knew that that was the most impactful. I knew that I heard the pleas and beggings from my families. I heard the court. I had case plans. I heard everybody, but I'd never heard anybody like I heard that girl who came into my cell. So when we sat down to do this, I knew that was important. So one of the most important components of First Day Forward is we hire staff that have been formally justice involved, and it's one of the standards. So you have to be in long-term recovery and have been locked up to work for First Day Forward. So what it is we paired that person, our staff, formerly incarcerated person in long-term recovery, with a person who's getting ready to get out. So we generally try to hit people 60 to 90 days pre-release so we can get to know them. Um, every time I got locked up and I got sober, the type A Brittany come out again, and I really wanted to do everything. I wanted to go back to school, I wanted to be a better mother, and I wanted to get a job every single time. But every time I got out, I was faced with reality. Oftentimes, I was released in the winter with a tank top because I'd been arrested in June. I don't know what happens to shoes in a jail, but I mean, I left jail with only one shoe twice. I had nowhere to go other than the places I had left. And every time I was incarcerated, I had a job, but when I left, I had no job, no home. I had less. Um, so the reality of getting out, getting a job, getting to be a better mother, and going back to school was not simple. You needed everything to do those things, and I had none of it. So we prioritize the three forms of identification, and we try to start those the day we meet. If the birth certificate's identified as a need, we can apply for that pre-release. We started First Day Forward during COVID, and it was really, really challenging. And we had actually became successful in Clark County in getting our inmates' IDs pre-release, but we're still navigating that. I know we've signed agreements with DOC, and they're helping us out with some of our people getting pre-release IDs, and we're really thankful for that partnership. But we want trust. We want trust to be built. We're asking people to get out of jail and to go to the Medicaid office and the food stamp office, and people don't realize that may be the same office where their kids were removed. We're asking people to get out and go get an ID, but we're also asking them to go to the same location where their freedom was taken, right? So having a partner and having some reassurance during these things is really, really crucial. Our peer support serves as a bridge to all these resources. And we're not reinventing the wheel. We're literally putting a person in place that's done it, that's lived through it, that's navigated it, and that can help them do that. And that's been so valuable. But birth certificate, ID, and social security cards are our priority, no matter what. The regional office has changed during the launch of First Day Forward too, which was a huge barrier. I hope we roll back and go back to county, but we're able to transport them. So while the person's incarcerated, our peer meets weekly with them. You can go ahead and go to the next slide. I do believe. Yeah, here's our program overview. We do an assessment the day one and an orientation. We just want to make sure that person's a candidate. To be a candidate, you have to be a person with a substance use disorder. You have to be returning to one of our service counties, so one of our counties where we can connect you with someone. And then the biggest factor is willingness. Getting out of jail and getting your life together is hard work. So we give that disclaimer at every orientation. Are you willing to put the work in? We don't expect perfection. We do not expect, no errors, but we want you to work because it's really, really hard to get on your feet. And if the answer to that is yes, you can come into the program. So the day we meet, we want reentry planning to start that day because that's not happening. Like you're just sitting idly for hours and hours and hours a day, and there's no planning. So we want that plan to happen that day on paper. What are you doing the day you get out? What are you doing the week you get out? What are you doing the month you get out? And what are some long-term goals? We want the brain moving in that direction. So our peer support meets weekly in a group setting. So they hold just a peer support group. And in two of our counties, we do portals curriculum, which allows them to take time off their sentence. In our other counties, it's just smart recovery. And then they also meet individually just to touch base. Hey, how you doing? What's going on? Anything changed? And we do that until the day they get out. The day they get out, our peers pick them up. Now, I want to tell everybody one of the biggest impacts this program's had across our whole region is inmate releases, which you may not believe unless you're involved in this world, always happened in the middle of the night. Unless a bond was met during the day or a judge release allowed a 4 o'clock release, but releases happened in the middle of the night. That could not happen. There is nowhere good to go at 1, 2 o'clock in the morning. Nowhere. You can't even get anybody good to pick you up at 1 or 2 o'clock in the morning. So we've worked with our jails to make sure people were released during business hours, and that's been amazingly successful. Our jailer in Greenup, Larry Pancake, even said, not only will I hold them, I'll feed them breakfast. So he feeds them breakfast and holds them until our peer gets there, and our peer picks them up bright and early in the morning. We remove them from the jail. I just remember wanting to run. I'm like, I've got to get away from this place. And I know after talking to many, many people, that's everybody's reaction when released. We've got to get away. We got to get away. So we make sure we get away, but we go to a safe, quiet place because we're doing another case plan. We're going to pull out our old case plan. We're going to say, 60 days ago, this was your plan, but stuff's real now. What are we doing? What's our plan for today? What's our plan for this week? What's our long-term goals? And we make a new case plan. And now we've got it on paper. It's signed. We have dates. So we make appointments, and those are often done pre-release as well. Did you want to add something, Carla?
I was just going to say the case plan is a duplicate paper so that the peer
Yeah.
keeps one and the client keeps one.
Yeah. Thank you so much. Yeah. We have carbon copied paper. We want accountability, and this is how we're going to use it. We often refer to those. Hey, bro, 2 weeks ago you said this was a goal, and we've got to get it done. But that's really our outline, and we go from there. We give each participant, depending on the funds we've got, Charter County only has $50 to meet these needs right now, but generally it's a $100 gift card to Walmart. Our peer takes them, we shop, we talk about your needs. Guys, there's so much dignity in a bottle of Old Spice or a Dove deodorant. When you've been in jail, there nothing smells. Nothing smells but other people. There's no scented anything. So giving dignity back in the form of a fresh pair of jeans or a clean pair of socks is really important to us. And the next 90 days is hustle. Our peer has to meet weekly with our people face to face, and then we also transport to at least the first 3 appointments. So all our participants have to have an SUD assessment. So by their chosen provider, they can choose any provider they want, but our peer generally takes you to your first treatment assessment. We want the first ID walk-in and the first food stamp walk-in. We want those first walk-ins to be done with a partner, with a wingman, and with comfort. And the next 90 days is checking as many boxes as we have. We did a needs assessment in jail and it's super comprehensive. And our goal for that 90 days post release is to meet as many goals as possible. 90 days is our minimum benchmark, but 9 times out of 10, people stay open much longer. I mean, we've had people in our program for 2 years just because their goals are challenging to navigate.
We also,
And
I'm sorry, Brittany.
no, you're good.
We also had one client that started in Clark County. So
Mhm.
this would have been 2020, 2021, and just completed the program a few months ago because she bounced around from Clark County to Carter County to Greenup County to Round County. But finally, she was successful and completed.
Yeah, and the crazy thing is about that client, her mother just shared this is the best she's ever been. And we hung with her. I mean, she struggled. I mean, she relapsed a couple times. She went back to jail on a probation violation, got out and tried again, and she's doing amazing. She's actually a manager at the gas station she works at now. So, really, really, really proud of her. And she did. She met with 3 of our peers over this process. But we can go to next. So this is our overall program statistics. When we launched in 2020, I would have never thought that we'd been able to, our goal was 40 people year one. The fact that we've served almost 900 people in the last 6 years is just mind-blowing. The most astounding statistic, and this one almost stays the same across the board, is the number of people that reported using before the age of 18. So 3/4 of the people that screened for First Day Forward reported using before the age of 18. And we very, very often see numbers as low as 9, 10, 11. And that's crazy. I mean, that's prevention efforts all day. That data supports that. We're sitting around a 40% success rate. I know Carla got really discouraged about our first round of numbers because it was a little lower than that. She was like, man, that's hard, and that's a win. To keep 40% of the people that we screen and assess and take into our program sober for 90 days or longer, engaged in our program, employed and housed, I mean, that's a win, a win. We have 35% of our participants that secure employment within our program time, and that number's higher. It's just a hard number to chart. And for years, we only tracked employment if it was if the peer helped with that directly, like the peer took them to the job interview, but we can't collect data like that. And the number we saw, and I want to give props to Kentucky, we've seen this number consistently drop. The whole first year, 2 years maybe, that we collected ID and Social Security card and birth certificate data, we were at 70% across the board. And it went from 71, 68, 71, and we're sitting roughly around 60% of people needing an ID now. So I want to give credit to our DOC and the efforts that our jails have made to get those IDs pre-release. And I'm really, really proud of our state right now, doing a lot of good things. And our recidivism number is amazing. Out of the people that we screen and accept into our program, the people that don't complete First Day Forward and really don't take advantage of that support and that process, go back to jail around 70% of the time. And the people that complete First Day Forward stay out of jail 28% of the time. And we've had that number as low as 25 at times. So we're really proud of that. Very, very proud of that. Next slide, please. All right, so this is special. Montgomery County is a very, very special county. One thing we always did, because we're working in our jails, we wanted to let fiscal court know what we were doing. We were never asked to do that, but we thought it was important for our county, just for our community to know what we were doing. So every year we go to our fiscal courts and we want to share our data and our outcomes. And we've done that with Montgomery County every year since implementation. And I'll get to the fiscal court in just a second, but this is our peer support, Mike McGee. He is a person in long-term recovery who found his way to a Kentucky jail about 6 years ago and got out, found recovery here, and he's lived here ever since. But Mike had a wreck in January, and it could have been really, really bad. Mike was very lucky, but he had to miss a week of groups at the jail, and all the guys were really, really worried about him. So when he got back, his group had grown a little bit. And the jail staff were so surprised at how many guys that wanted to come check on Mike to touch base to see how he was doing that they snuck a picture in the back of the room. And this is from jail staff. They wanted to say, we've never had groups this size. And Mike's groups are continually this size. They're so big now that he has to have two groups for males every week. Um, but they're just in it, man. They connect with him and they want to hear what he has to say. Next slide, please. In the fall of last year, we presented to fiscal court and we were telling them this would honestly be our last reporting. We were unfortunately had reached the end of our extension period with HRSA, and we were there to share our gratitude and to share outcome data and just let them know how thankful we were. We were hoping to continue just as pathways to support the jail in any way we could. We just wouldn't be able to offer that transition into the community with that intensive support and then, of course, access to resources. Um, and they listened to us and they shared. And at the end of our presentation, the secretary um, and the judge exec said, "Hey, why don't you send us more information? We've got these funds and we think this works. We want to double check." And I think they reached out to Lauren to make sure that the first day forward fit into the criteria for opioid abatement spending. Yeah. And of course it does. And they funded us and we couldn't believe it. We couldn't believe, well, it's just an honor. It's an honor to know that the county, and the coolest part was the jailer um, was all in. He was absolutely backing us. He absolutely supported this. And he was our biggest cheerleader with First Day Forward. They really loved the program. But yeah, this is a picture of us receiving Montgomery County abatement funds, and that'll keep us running all year. Very, very thankful. And another thing, you can go ahead and go to the next slide. Another thing I want to share before we jump into Montgomery County data is touching base on what Lauren shared, where you don't have to reinvent the wheel. The Fletcher Group, which is a national organization, heard about First Day Forward and asked if they could do an economic impact report on us. And we were like, yeah, we'd love to know. We'd love to know if we're making an impact economically. And their health economist, when she was done studying our data, come back like giddy. She was so excited. She said, "We've never had a return on investment this large." She did all six of our counties. Our lowest return on investment was $10 and our highest was $14. So we're getting a $14 to $1 um, investment, a $14 return on our highest yielding county. And it's because we're doing exactly what Lauren said. We're not building buildings. We're not paying electric bills. We're not sustaining brick and mortars. We're using people with lived experience. We're paying their salary, putting them in with people who are trying to figure out how to be that, and letting them navigate that person through this process. There's a small allotment of funds that pay for IDs and birth certificates and then basic needs, of course. And we've been blessed to offer a little bit of housing funds for sober living. But that's so small. We're just using what the community offers. We're using employment services offered in each community. We're using recovery supports that are unique to each community. Our peer supports already know this stuff. They've navigated it. We're using their expertise to help this person get through this. And Mike is brilliant in making sure his people are integrated into the recovery community there in Montgomery County and surrounding areas. So our return on investment is high because we're doing exactly that. We're using the expert and allowing them to navigate that person using the things that exist in that community or unique to that community. So this is our Montgomery's data prior to, this is prior to, is this current to date, Carla, or is this prior to abatement? Current to date, yeah. So we started in 2021 with our implementation 3 grant, and we've served 63 females and 77 males. And that number would have been stinking higher, but we had some staffing issues in that county a couple of times. So we had some lulls there. But you
And
can see, good.
sorry, I was also going to say that number would have been way higher, but like Mike's groups, we hadn't been recording the people
Oh,
coming to the groups if they was not an actual First Day Forward participant. So
yeah.
just starting in January, we started reporting the number of individuals that came to the groups, even if they weren't a part of First Day Forward.
Yeah, so that's one thing we definitely decided. I remember wanting programs in jail that I did not have access to. I didn't want anybody to feel that way about this. I wanted everybody to have access to, and it's, of course, jail's discretion. So Mike may only be carrying 3 or 4 people currently incarcerated in the program, but anyone from those cells that are permitted to come that would like to come, as space allows, can come to our groups. So we want to make sure that support, encouragement, hope, and that's ultimately what our peer brings is offered to everyone. And Carla's right. We have never tracked that. And our peers do so much work outside of just the direct service work they do. So hopefully we'll have good outcome data from that as well, because we did just start in all of our counties. Montgomery County, age of first use is a little lower. I think Carter County is definitely one of our higher counties in age of first use under 18, but that's still high, sitting at 64% using as a child. Next slide, please. I feel like I'm bossing you around, whoever's clicking. Sydney, Lauren, I'm so sorry. So since the beginning of the year, we've served 9 participants, 4 females, 5 males. Those are our age ranges. 4 of those people used before the age of 18. We have 5 still active, but that's probably 4 because we completed one this week, I think,
Yeah,
because we staffed them yesterday.
mhm.
3 successfully completed. We had 1 participant that was unsuccessful, and that would have been 4 successful. And we've had more than 30 clients attend the group with mics, and those impacts, we're not measuring those, but we know they're good because I've experienced that firsthand, the impact of someone offering support, encouragement, and hope. Next slide, please.
I was going to add quickly, Brittany, I'm sorry, I don't mean to
No, you're good. No, please, you're good.
but when we look at the data from now back to when we started in 2020, if you can go back one slide, that 40 range is a lot higher now than it was
Oh,
when we started, because when we started, we were getting mostly 30s, 30 to 39, but now people are sitting in jail longer, been using longer, so we're seeing the older ages.
yeah, that's a really cool statistic to point out, Carla. Sad. And
Sad.
Montgomery County, I mean, they sit for a long time there. I mean, every one of our counties functions unique to them, but our Montgomery County folks sit a long time. Okay, we can go to the next slide. So we could make it rain these. So one thing we do at the end of every participant's journey is to do an evaluation, and it's private and confidential. They could submit it from their phone. It goes straight to Carla. Um, but the participant we graduated last week said the first day forward was what he considered a gift from God. And you can see his quote there. It's given me a positive outlook on life and provides ways to overcome obstacles in life that once felt impossible. I have hope and peace of mind and a better understanding and views of my future. I would suggest every person take the time and opportunity as I did. It will allow you to find out who you truly are. And then we asked specifically about his relationship and engagement with the peer, and you can see what he said about Mike. He has been a good friend and peer from day one. And First Day Forward doesn't end. We always check in. So we keep our clients' contact and we try to update that when it changes, but we contact consistently. Just checking in, how you doing? How's things going? So even though the program's over, that relationship doesn't necessarily end.
And I don't know if Mike was able to join us or not. But and Brittany, you can jump in on here because I may have the wrong impression, but Mike is pretty tough.
He is.
So when he gets a client, if that client is not doing what they need to do, Mike's going to try, but he's not going to waste his time trying to help somebody that doesn't want the help. So he's pretty tough on them.
He does. Honestly, and that's the power of the peer. I mean, clinicians are amazing and they're therapeutic and they have an amazing way of getting in someone's mind and spirit, but a peer really has the freedom to speak in a way that a lot of other people in the treatment role can't. I mean, they can be honest and they can be brutal and they share from a place of understanding. I like to call Mike like a spiritual hammer because he is super spiritual. He's very calm, but he's going to tell you the truth. And a lot of our peers have that gift, for sure, for sure. Brutal honesty, even when it sucks, but it's real. Next slide. So these are some of the services we've provided. Just since January, we've gotten 6 driver's license, 1 social security card, 6 birth certificates. We've had 3 of our participants obtain employment, and then we've provided 2 with housing assistance. There's an Oxford house in Montgomery County that people have been able to go to. And then 169 peer visits. So Mike has met, that's each individual person he's met 169 times in some form or another. Next slide. And that's it. Love to hear feedback from you guys. I saw Jeremy, my neighbor, my across the street neighbor on here. But this is First Day Forward. We'd love to answer any questions. It's something we're really proud of. And guys, when I tell you that quote from our recent participant, we have dozens and dozens of those. So when you think you're not, oh God, the data's not showing or we're not making an impact, check this. Our very first participant during COVID, she was released on ankle monitor. And she had already signed a plea agreement for 7 years. Okay. So she knew she was going to jail, but she didn't want to go to jail strung out. So she got out on an ankle monitor, went to residential treatment, spent 90 days in a rehab, and our peer went and saw her every week. She got out of treatment, and our peer encouraged her to step down to an outpatient program. So that's what she did. She went to an outpatient program. While she was in that outpatient program, through connections with the peer, got a job at a steakhouse, still on bond, still on ankle monitor, and she was going back to court for the court process during this time. But while she was doing this, she had then become a sponsor. She had celebrated 2 years in recovery. She became a manager at this steakhouse. She started hiring First Day Forward participants and other people in the recovery community. She had created such an ecosystem at this steakhouse that they celebrated recovery birthdays on the back line. Like she was taking people to meetings, picking people up, taking them to work. She had created this own little ecosystem we were counting on her for. I mean, she was part of our referral chain at that point. But she had signed that plea agreement saying that she was taking years. The judge that bothered the judge so much because she had changed her life so much. She kept going back, and the judge kept putting her off. I don't want to sentence her. I don't want to sentence her. The final court hearing, not only did our peer go, we had two peers in both counties went from the both counties she had been in, First Day Forward, and several staff members, of course, her recovery community, all showed up to this court hearing, and the judge found a clause in sentencing that says if sentencing this person to jail would cause more harm to the community, he could divert the sentence. And that's exactly what he did. He let her go, and she's so remarkable. We tried to hire her, and she turned us down
She's
because God had
actually,
a purpose for her at the steakhouse.
she's
But,
actually working here now.
and yeah, now she's working for St. Clair. But
Yes.
she's just remarkable. And she was our very first participant. And it makes me emotional because she really has made such a big impact. But it's the ripple effect of lived experience and really just taking the time to be intimate and to guide someone through reentry. So now I'm done.
Well, and it's seeing the peers in the communities that they were using and seeing how
Yeah.
successful they are that really helps with stigma. And as part of stigma, the QR code there, we do videos of the peers telling their story, and we put that on the Facebook just to help reduce stigma in communities. If anybody wants to watch those, you can scan that QR code.
Yeah. Thanks, Carla.
Before we close and I want to go into questions, I just want to emphasize the importance of connection and compassion of this work. From one end of the state to the other end of the state, I saw Brittany and Carla and Marianne speak on this at the Opioid Symposium, and I knew that this was something I wanted to bring to our members. And you might think about, well, we can't have a program or we have another jail. I guarantee you, sometimes it's just allowing peers to come in. And so every region, every county in the state has a community mental health center, or you have a recovery community center. And so I highly encourage you all, if you all think, oh my goodness, I can't do a program, or we don't have the funds to do this or that, I highly encourage you to connect, because with your recovery community, we have information. If you don't mind to go to the next slide, Sydney. Next slide. So we have resources on our website. Yes, right here. This is what I was going to talk about, on our Keiko Opioid Solutions website. So I highly encourage you all to go there. This is where you'll find your go-to kind of questions and answers. All of the webinars are recorded, and all the slide decks are on in that archived training and recordings. And so again, thank you, and I want to open it up to questions. And even if you guys just have a question or comment, I do want to open it up. But I want to just thank you all for sharing about First Day Forward. And Brittany, thank you so much for sharing your story and your lived experience with the group, and including your experience about incarceration. It takes courage to openly speak about these experiences, and stories like yours really make an impact, and remind people that there is life outside of the chaos. And so sometimes we only see the jail, we only see the budgets, we only see the draining, but we have to remember that there are people. And so thank you for that. And counties have the ability to, in the funding with the opioid settlement funds, to support programs like this and strengthen the pathways to improve access to treatment. And as we know, it's not a one size fits all approach. Treatment looks different for everybody, but I highly encourage you to reach out and involve some recovery support in your jail. And when you think about your broader strategies, just think about how opioid settlement funds can support those. And I'm happy to connect you all with any additional questions or resources. And thank you all to your time here. And we do have a little bit. If you want to go to the next slide, Sydney, this is my contact information and everything that I do. So if you guys have questions, comments, concerns, or you have a proposal, or you have an idea of how to do a program in your jail, please reach out to me. And then, yeah, and so I want to open it up to questions. Is there any comments, questions that you have for our speakers or myself today? Carla, Brittany, is there anything else you would like to share with the group?
No, just really thankful. I mean, very, very, it's an honor to be here. It's an honor to be with so many great, wonderful people and making an impact in their communities. I know the hard work that city, local government leaders do every day. I'm very, very thankful for the work you do. Very, very thankful for your open-mindedness. And you hung in there, especially you with the camera on. You didn't even make faces. So you did really good.
Yeah, just thank you all. I just wanted to mention one more thing. Back in November, we pulled a little bit of different data. At that time, we had 41% of people that had successfully completed the program, and 37% of the successful participants we provided housing for. So housing is so important for recovery. So if anybody doesn't have a jail, but they want to invest, I mean, maybe you look at safe housing, transitional housing, sober living, anything to help people be able to get out of their current situation and live somewhere safe.
Great ad, Carla. Thank you, guys.
Yeah. And so if there is no other comments, questions, I just got a chat that the Barron County River region partnered with their Reentry Council to provide backpacks into 5 of their jails. And so again, we don't have to reinvent the wheel. We can always do this and provide those services. So however it fits into your community, it's a if you've seen one county jail, you've seen one county jail. They're not one size fits all, but I highly encourage, and especially with that recidivism rate, having that support and the connection is key. And so, if there are no other comments, questions, or concerns, I will give you guys 10 minutes back of your day. But again, I cannot thank you all enough for being here, presenting, and then I know that this is a busy, busy, busy time of year. So thank you all again for your time and dedication to this topic.